In this discussion, we will speak about sepsis. We will be speaking about the pathology, clinical presentation, diagnostic steps, and the treatment. We have barriers against infections, but sometimes the infections can enter the body. And when it enters the body, our body fights against the infection. Once a bacteria is entered into the body, it is being identified by the macrophages. And the macrophages start secreting pro-inflammatory cytokines. And these cytokines act as a signal. And this signal attracts more cells to the site of infection. They come to help us fight against the infection. So there are two scenarios. We can either fight against the infection and win the battle. In that case, the infection is being limited to one location and we can control that. But sometimes the infection can invade the body. And this invasion of the bacteria throughout the body can cause sepsis. However, there are many reasons for this. It can be either bacterial factors, so it could be the bacterial cell wall. So in bacterial cell wall, it could be either due to endotoxins, peptidoglycans, or lipoteichoic acid. Other factors could be the bacterial products. For example, staphylococcal enterotoxin B, toxic shock syndrome toxin 1, pseudomonal exotoxin A, or group A streptococcal M protein. There are multiple risk factors that may cause sepsis, and there are some patients who are genetically susceptible to sepsis. So when this happens, there is cell injury and any organ can get affected. Now let's look how it affects the organs. It can affect the circulatory system. So when the heart and the circulatory system is affected, it contributes to vasodilation, which is presented as hypotension. When the lungs are affected, it can cause pulmonary edema, leading to VQ mismatch and to hypoxia. So this can be presented as ARDS. The effect of sepsis on the gastrointestinal system is that it is affecting the normal barrier of gastrointestinal system. So the bacteria can enter via the lymph or the portal vein into the body. More bacteria is entering the body. The effect of sepsis on the liver is that it increases AST and ALT. So the liver reticular endothelial system cannot function properly and it cannot clear the bacteria. The effect of sepsis on the kidney is that due to the hypotension, it can lead to acute renal failure. So during sepsis, there can be hypoperfusion leading to acute tubular necrosis, thus increasing the BUN and creatinine. The effect of sepsis on the central nervous system is presented as encephalopathy. However, the reason behind encephalopathy is not known. But we know if the infection is within the brain, it's going to cause more symptoms rather than if it's outside the brain. And it is presented as altered mental status. And these are the usual clinical presentations in sepsis. Now let's pay attention to diagnosis of sepsis. High clinical suspicion is very important. In sepsis, features to remember are hypotension and hyperlactemia. In sepsis, there is organ dysfunction along with infection. In septic shock, there is sepsis plus patients not responding to fluids. They do need vasopressors to maintain the pressure more than 65 and the lactate levels is going to be more than 2 millimoles per liter or more than 18 milligrams per deciliter. So labs can be drawn to look for lactate levels and looking for the ABG and to send for culture. And imaging testing can be used. For example, chest x-ray can be performed to see for any pulmonary edema. Now let's briefly discuss the treatment. Treatment involves securing the airway and maintaining proper circulation. For that, we must have vascular access. And this vascular access can be helpful for two things. One is giving IV fluids and the other one is for giving antibiotics. And the IV fluids should be started in the first hour and the amount should be 30 milliliters per kg. And these IV fluids must be completed within 3 hours. And the crystalloids must be used, so we can use normal saline or lactate ringers. Speaking of the antibiotics, broad spectrum antibiotics must be used. It means to cover gram-negative, gram-positive, and if suspected, fungal or even viral. And you must use at least 2 antibiotics for at least 7 to 10 days. And one more step in the management is drawing labs every 6 hours looking for the lactate levels. And if administering fluids is not increasing the blood pressures, vasopressors might have to be used. And we can use norepinephrine, but if not responsive, we can use glucocorticoids, inotropes, or even blood transfusions. Now let's see what our goals are. So we must be maintaining the mean arterial pressure of more than 65, and the central venous pressure, which is measured by the internal jugular vein, should be around 8 to 12, and the central venous oxygen saturation must be more than 70%, and the urine output must be more than 0.5 milliliters per kg per hour. While maintaining all these factors, we must pay attention to removing the infectious source. Okay, let's summarize sepsis. Sepsis is when an infection spreads around the body, which can be due to many reasons, and it can cause cell injury, which can be affecting any organ in the body. Most commonly we see hypertension. High clinical suspicion is helpful for the diagnosis, and lactate levels can be drawn to determine sepsis, and these must be continued every 6 hourly to look for improvement in the patients. Broad spectrum antibiotics are used, and fluid management is very important. Sometimes we have to give vasopressors. However, the goal should be maintaining the arterial pressure, maintaining the central venous pressure, and maintaining a good kidney function by checking the urine output. And finally, we must pay attention to removing the infectious source. And that concludes sepsis.